Good morning, colleagues, and thank you to Aileen and to Angela. Before we get into the meat of our programme, I'd like to just take a minute to reflect on all the different people who are here with us this morning in this room. And I'm delighted so many different professions, disciplines and leaders from such a wide range of local government and public services have come together today. It speaks volumes in terms of our commitment to improving public health. So welcome to everyone. In my role as the COSLA spokesperson for health and social care, I spend a great deal of my time making the case for the public's health being about far, far more than just our health and social care services. I spend a lot of time championing the unique role of local government in public health and all that we do to protect and improve our communities' health and well-being. By empowering people and working with them to build safer, stronger, healthier places and communities, healthier environments in every sense of the word, councils are at the forefront of making the shift to prevention and co-production championed and envisioned by the Christie Commission. Councils working with their community planning partners are also at the sharp end of tackling inequalities in health which still blight too many of our deprived communities. These inequalities, I would argue, only really become apparent at the local level, and are often felt most acutely at neighbourhood level. I'm sure each of you will have neighbourhoods within your own council areas that differ greatly in terms of outcomes and healthy life expectancy, and I know that each of you will find this as unacceptable as I do. For many, the fact that these inequalities are manifest at such a local level points to a local solution, and local solutions are something which we in local government hold dear. But as with many things, it's more complicated than that. I don't need to tell the audience here that poverty is a major driver of poor health, and one part of the system acting alone can no more eradicate poverty than the NHS can prevent poor health. Welfare reform, taxation, international investment, the list goes on, all have their part to play. Many of Scotland's most intractable health issues are intractable because their causes are complex. Tackling obesity and addiction, getting Scotland more active, and giving our children the best start in life all require concerted effort by a wide range of our partners. Clearly, we need change across the whole system, across the voluntary, public and private sectors, and the national and regional and community levels. But above all, from my perspective, we must strive to do things with our communities, not do things to them, as together we deliver these much-needed changes. As you'll be aware, COSLA and the Scottish Government jointly announced our public health priorities earlier last week. They represent agreement between both spheres of government in Scotland that these are the issues we really need to focus on. But they are not just government priorities, albeit agreed by our national and local government. They must become Scotland's priorities. And that means they need to be owned both at national and local levels and by our communities across all policy areas and across all sectors. The priorities were built from the bottom up, taking local outcome improvement plans as a starting point to ensure they fit with local priorities. COSLA and the Scottish Government are now working with partners to build consensus around these priorities, and the next step will be to take action across the whole system to secure change as part of our joint programme of public health reform. COSLA very much sees public health reform within the context of wider public sector reform. The test, surely, of any reform proposals must be the extent to which they can realise the vision set out in the Christie Commission to tackle inequalities, strengthen communities and place public services on a more sustainable footing. That presents us with some significant challenges around how we ensure the whole of the public sector is contributing to improving health and well-being without taking our eye off the ball on core businesses like health protection, and around how we balance bespoke bottom-up approaches with the need to secure economies of scale, all within an extraordinarily tight fiscal situation. I won't for a minute pretend to have all the answers to these questions, but I do think they lie in cohesive political leadership, working collaboratively with professional expertise and our communities themselves. I also think we've been able to build a strong foundation for public health reform in that respect. We have political buy-in from both national and local government, and we're working to an agreed set of principles which set the parameters for our work and focus on strengthening the public health workforce in its widest sense, in order to better support improved health and well-being for our communities. In addition to agreeing public health priorities which give expression to the range of contributions required and focus on the most significant areas for action, we must ensure that the new public health body has meaningful accountability to both Scottish Government and local government, and a clearer relationship with community planning partnerships and local communities. We want the new public health body to provide leadership and a critical mass of expertise. For this to be used to greatest effect, it needs to respond to the needs of local strategic planning, with local partnerships able to work with the body to agree how it will provide support for local agendas, including by helping to involve and empower the communities we seek to serve. In taking forward our reform agenda, we are absolutely clear that local government must be at the forefront of local leadership for public health transformation. We want to articulate a clear vision for local government as part of a reinvigorated and whole system approach to public health. This means we want to think creatively about new ways of working together across professional and organisational boundaries, with communities at the centre, the heart, to deliver the step change in health and well-being. I recognise there's plenty of challenge for us all in there, but I'm certain that by working together, we can begin to achieve the changes we all so desperately want to see. Thank you for listening.